My dear students, in the topic excretory products and their elimination, we are having some important things to be discussed at the last of the chapter. That is, what is artificial kidney? What is artificial kidney? If there is failure of the kidney, kidneys can be reproved, kidneys can be replaced, or sometimes if there is the damage in the kidney, there is an artificial kidney. This artificial kidney is called as hemodialyzer. Hemodialyzer. We have to see what is this hemodialyzer. It is a machine that is used to filter the blood of a person whose kidneys are damaged. The process is called as hemodialysis. Hemodialysis. It results whenever there is a pathogenic attack to the kidneys, or sometimes whenever there is a damage due to an accident and the kidney gets lost or damaged, wholly or partially. At that time, we need the artificial kidney, what we call as hemodialyzer. Hemodialysis may be defined as the separation of small molecules, crystalloids, from large molecules, colloids in a solution, by interposing a semi-permeable membrane between the solution and the water, dialyzing solution. So this hemodialyzer puts a semi-permeable membrane, a machine which has a semi-permeable membrane, so as to put small molecules, what we call as the crystalloids, from large molecules, colloids in a solution, by interposing a semi-permeable membrane between the solution and the water. The use of artificial kidney involves a good deal of discomfort and a risk of the formation of blood clots. There is a lot of discomfort because it cannot compensate the original kidney, and there is also a risk of formation of the blood clots. Risk of formation of the blood clots whenever this hemodialyzer is introduced into the patient. It may cause fever, anaphylaxis, cardiovascular problems, and hemorrhage. Kidney transplant is an alternative treatment. So we have another treatment for this. If the artificial kidney does not work, we have kidney transplant. Kidney transplant is the introducing a new kidney to a recipient that is obtained from a donor. This transplant is a natural kidney present in a person who is called the donor. Grafting a kidney from a compatible donor to restore kidney function in a recipient suffering from kidney failure. This is called as renal transplantation. Renal transplantation. Whenever we select a donor, that donor donates the kidney to the recipient. This recipient has lost the kidney due to the accidental damage or pathogenic attack. The first kidney transplant was performed between identical twins in 1954 by Dr. Charles Hufnagel. The first transplant was done in 1954 by Charles Hufnagel. Charles Hufnagel was the first doctor who could make this transplant possible. He was a Washington surgeon. India's first kidney transplant was done on December 1st, 1971 at Christian Medical College, Vellore, Tamil Nadu. The recipient was a 35 years old person, Shenu Gonal. There is an eligibility of this. How can the kidney transplant be performed? All patients with terminal renal failure are considered eligible for kidney transplantation, except those at risk from another life-threatening disease. So far the donors are concerned, all living donor can be used in a kidney transplant. It may be an identical twin, a sibling, or a close relative. If the kidney donors are not available, a cardiovedic donor may be used. Cadaver is a dead body. Over half of the kidney transplants are from cadavers. Over half of the kidney plants are from cadavers. These cadavers are dead bodies. When the persons die, the kidneys can be immediately removed, and we can say the transplantation can be done. So far the success rate is concerned, a kidney transplant from an identical twin called isogenic graft or isograft is always successful. A renal transplant from a sibling or a close relative or a cadaver termed allogenic graft or homograft is usually successful with the use of an immunosuppressant. Why immunosuppressant is used? Because it suppresses those antibodies which are against and those immune reactions which are against the allograft. This depends upon the body's immune system. This is all about the artificial kidneys, what we call as hemodialyzer, and the process as hemodialysis, and the kidney or renal transplantation or grafting. Thank you.